I am here to help you improve your health to live a good life. Hi everyone, my name is Zonna. I'm a physical therapist from Orange County, California, and you're watching my channel, Zonna Physical Therapy. Today I'm going to discuss how to protect your ankle during high impact activities and exercises, as well as how to prevent re-injury to your ankle. And just as a reminder, you always have to seek medical professional advice, physical therapist or your doctor, before you do any type of activities or exercises. And just to let you know, this is a general advice, so this might not apply to you. So it's very important that you do a consultation and work with your physical therapist. First, I'm going to discuss on how to work out with an injury on your ankle. Of course, a good exercises that you can do are non-weight bearing exercises. Swimming would be good, or doing exercises in the swimming pool, doing range of motion on your ankles, and as well as sitting and working with your ankles in sitting with the TheraBands. One thing to consider when you have ankle problems or you have injured your ankle is that you have to at least watch your diets and put a good nutrition inside your body, especially if you have ligament tears. That's very important. There are two nutrients that are very important to help improve ligament healing, especially if you have torn your ligaments in your ankle. The two best nutrients to take are the silica and vitamin C. I heard curcumin is also good for anti-inflammatory. So curcumin, vitamin C, and silica are all very good nutrients. So this helps a lot to improve healing with your ligaments in your ankle. Another thing that could help is if you lose weight. Weight is a big factor when you have some ankle issues, and so it's always good to watch your body weight, and if you need to lose some body weights, it's very important, especially if you have issues with your ankle. When you do your exercises with the ankle injury, you have to consider low impact exercises and even non-weight bearing exercises in the early stages. Especially if you have swelling and in a lot of pain, you must focus on exercises that doesn't aggravate the pain, such as sitting and not putting weight on it. You could do gentle range of motion exercises just to make sure you keep your blood flow going, and so you don't aggravate and increase inflammation or swelling on the joints. As it gets better, you could start low impact activities such as swimming or doing your exercises in the pool. That really helps a lot. Or even standing on one leg at a time for a few seconds, as long as you can tolerate the pain, or you can at least, or even you can try to take some pain medications before you do your exercises. And not exercising at all is also a bad thing, because this could retard the healing, and overall it's not good for your body. The circulation will get affected, and so you will heal slower and you can get more complications. So you must do some exercises within pain-free range. In the first 24 to 72 hours of injuring your ankle, you have to at least rest, put ice on it, even compress and elevate. So these are very important to do. When the pain goes down, then you start doing the exercises. Usually in about 4 to 7 days, you should start doing some exercises. In about 3 to 7 days, you should see some improvement and decrease of pain. However, if the pain persists, you have to immediately go to your doctor and get checked. You could also put a brace when you know you'll be walking for that day, just to protect the ankle and make it more stable when you do these activities. Stretching is also a good way to prevent stiffness and prevent tightness on the ankle as it heals. However, you have to make sure you know what the severity of the tear is. If you have ligament tear, you have to be very careful on doing the stretches. So there are different grades of ligament tear and severity. And usually if you have this kind of damage, your ankle will be very painful, and you might not even be able to do the exercises at all. After about a couple days and you don't see any improvement with the swelling and the pain doesn't improve, it is important to see your doctor and probably have an x-ray done, at least an x-ray, just to know what's going on in there. because if you only have a mild injury in your ankle and you do this ice, resting, compression, elevation, there should be an improvement, decrease of swelling, decrease of pain if it's only mild injury. But if nothing happens and it just gets worse and worse every day, then you must go and see your doctor. A lot of us have ankle sprain, minimal or minor injuries in our ankle, which normally, for the most part, it's not an emergency situation. However, you have to be very mindful and careful with your activities in the first few days of injuring your ankle. Make sure you protect it, because if not, if you jump in right away and go back to high impact exercises and activities, you might damage it more and might cause more harm. And if you're doing a lot of sports and you don't rest and you go back right away to your high impact activities, this could cause more damage to your ankle. So you don't want to take a risk, because without your ankle and your feet, obviously you won't be able to walk. So this is really important. So as your ankle gets better and you feel confident that you could go back to some high impact or exercises that or any activities that you were doing prior to this injury, or even just plan to go for a lot of walking, you must wear a proper footwear and put some brace on if you can. And if it's possible and it doesn't bother you when you're doing that activity, then it is important to get some brace on your ankle. It's always good to wear a brace in order to protect it and make it more stable. Also, one other exercises that is very easy to do at home is that you could lift your heel by standing on your toes, but you have to do this really slow and within pain-free range, so you don't want to overstretch. Make sure you talk to your doctor and physical therapist about the timing when you should start your strengthening exercises for your ankle. Typically, you can start when you're able to stand without increased pain or swelling. You can do about 8 to 10 repetitions of these exercises for your ankles for about 2 to 4 weeks, depending on the severity of your injury. And of course, depending on your tolerance to pain. Icing the ankle for about 20 minutes after your exercise could actually help prevent increased swelling and not to have an after effect or increased pain. Swimming is one of the best exercises as well, because you could do a lot inside the pool and you have of the water, just enough to have control over, as well as it's good overall for your endurance. You must not forget to do other exercises that are good for your other joints in the body. If you have ankle pain, you cannot just focus on that painful joint. That's why swimming is really good if you can access the pool and still continue all the other exercises. So maybe doing some squats on your good leg, standing on one leg with the squats, and all these exercises that you already are doing. Try to avoid too much immobility and make sure you stay on top of your exercises and endurance training. Pool exercises is very good for that. While you're trying to recover from the pain, you could also do a lot of arm exercises, strengthening for the arms, or even bicycle using arm bike. That's really good for your endurance. So that is it for my short video for today. I hope you learned something, and make sure you subscribe, share to your friends. If you know of someone that could possibly benefit on this video, please go ahead and share them. I would really appreciate it. Thank you so much again, and I hope to see you on my next one. My name is Zonna, physical therapist from Orange County, California. I am here to help you improve your health to live a good life.